Hello, this is Dr. Josh, physical therapist. In this video, we're going to be going over the different types of treatments and interventions you should be looking for if you're currently experiencing chronic pain, if you've been experiencing pain for 6 months, 12 months, or even potentially longer. First and foremost, if you have had a recent back injury and are unsure if these types of interventions or treatments would be appropriate for you, make sure you watch our previous video discussing red flags with back pain and if it would be appropriate for you to go into your doctor to see if there is something serious going on. So I'll put a link in the description to that video. So again, if you've had a recent back injury, make sure you check that out. This video is going to apply to those that have been experiencing chronic pain for several months or even years. So make sure you check that out before progressing any further in this video. So again, this is going to be designed for what types of treatments we're looking for if you're currently experiencing chronic low back pain. So first and foremost, we'll discuss what the evidence shows and what types of things you should be doing if you're experiencing chronic low back pain. The first thing you want to do is make sure you are educated and are understanding of how chronic pain works, how the chronic pain cycle works, and how it can progress over time. This is going to be super important as this is going to allow you to understand why your pain is occurring and allow you to understand how to get out of your pain as you break that cycle. Building off of this as well, it's going to be important that you understand different types of ways to prevent injuries, including how to lift objects, how to move appropriately, types of exercises you can be performing, things along those lines. So it's important that you find ways to educate yourself as this is going to help reverse that cycle out of chronic pain and get you back on track as you improve your health. Second big thing we're looking for when treating chronic low back pain is performing some type of physical activity or therapeutic exercise. And as stated in several videos on our channel, there's no clear evidence as to which type of exercise is the best exercise for chronic low back pain. The biggest thing is just to find something that you can be consistent with and something that you enjoy doing. So examples, we've talked about walking, Tai Chi, yoga, strength training, stretching, anything that you enjoy, anything that gets your heart rate up, any type of physical activity is better than not doing any type of physical activity. So whatever you enjoy and something that you can also do with other individuals, family, and friends is going to be extra beneficial with this. Third big thing we're looking for when we're treating chronic low back pain is to attack chronic low back pain with a multidisciplinary treatment programs. This is going to include different types of behavior change and daily habits that you can incorporate throughout your day. It's also going to include physical and psychological interventions and also improving stress management strategies. That way we can ensure that we are treating the entire person and not just focusing on the low back or where your pain is occurring. So it's going to be super important that we focus on improving our overall health. This is going to include eating better foods, improving sleep quality, trying to decrease smoking, alcohol, increasing water intake. All of those different things that include improving our overall health are going to be super important and crucial when it comes to treating chronic low back pain. So on top of this, there's other things that you may have heard of, may have tried in the past, and you're not sure as to if they provide any type of relief. So these are going to be the types of things that we're not going to incorporate as much because there isn't a ton of evidence that shows that it's going to help if you've been experiencing chronic pain for several months or years, or these types of things may actually be contraindicated if you are experiencing chronic pain for an extended period of time. So this is going to include different things such as manual therapy, ultrasound, acupuncture, dry needling, injections, nerve blocks, pharmacological therapy, laser therapy, epidurals, potentially surgeries. All of these things are things we're going to try to avoid when it comes to treating chronic low back pain. As we've discussed in several videos on this channel, the root cause of the chronic low back pain is likely going to be tied to sedentary lifestyle, lack of exercise, lack of stress management, things along that. So if we're focusing on these passive treatments and things that are going to provide some type of short-term relief without a lot of active engagement or active exercises, these things aren't going to likely provide long-term relief. It takes a long period of time for chronic pain to develop, so it's unlikely that these short-term interventions are going to provide long-term results. So again, these are going to be different things we're not going to focus on when it comes to treating chronic low back pain, because it's unlikely these are going to help in the long run unless you are addressing those first three things that we discussed in this video. So to summarize again, it's going to be super important if you're experiencing chronic low back pain that you are educating yourself on chronic pain and how to move appropriately. You're performing some type of therapeutic exercise or physical activity and trying to do this every single day. The third thing is focusing on behavior change and other daily habits that include improving your overall health. Again, this is going to include improving your sleep, managing your stress, eating better foods, things along those lines. So let me know if you guys have any questions about the content of this video. As always, like this video, subscribe to our channel, and leave a comment if you have any questions or have any other ideas on videos that you would like to see in the future. Thank you again, everybody, for watching this video today.